Well, good morning, everyone. Bob Ravenscroft, Vice President for Advancement, for today's press briefing. And man, we have some special guests here today. Joining us after the presentation of the daily COVID report is Russ Gronwald, the CEO of Bryan Health, Dr. Steve Joel, the Superintendent of Lincoln Public Schools, LPS's Board of Education President, Kathy Danek, LPS's Director for Strategic Initiatives and Focus Programs, Dr. James Blake, and then Provost from the Bryan College of Health Sciences, Kelty Anderson. Again, they'll come up to the podium after we present the daily COVID response as usual. At the conclusion of their remarks, we'll come back up and answer any of your COVID questions or field questions from them. Before the COVID stats, obviously it's been a great week for us. The vaccinations continue today. And again, we're using the priority distribution plan. It's working well and will continue as allocations arrive. Our drive-through numbers have dropped a little bit, which is actually encouraging news as well. The UNL testing plan was a great shot in the arm to see what they're going to be doing this spring. And as you'll see, our hospitalizations continue to decrease. We really, from the bottom of our heart, thank the community members here in Lancaster County and the state for helping blunt the spread. Your masking and responsible behaviors are really making a difference. So go ahead and pull up the slides, Jeff. Our midnight census, if you look over at the far right-hand side, was 487 patients. You can see there that our COVID patients have really been cut in half since really over the last 2 weeks, from 133 on the 2nd of December down to 65 now. On the next slide, you'll see that we still have 15 patients in the ICU, with 12 of them on ventilators. As you go to the next slide, you'll see that our patients, it's almost a 50-50 split, a little bit more from Lancaster County, dramatic difference from what it was earlier in the month. And then just on the last slide, it's still, hard to see families lose loved ones, and, we're at about 158 now. So what we are inviting everyone to do is join Bryan in the governor's effort to pray for these families this weekend who have lost a loved one due to COVID-19. More detailed stats will be sent out in the press packet that Brad usually sends out to you. So with that, it is my pleasure to introduce Russ Gronwald, the CEO of Bryan Health.
Good morning. I'm Russ Gronwald, the CEO of Bryan Health. And despite all of the really good numbers, as you can see, COVID-19 remains a real aspect of our daily work around here. It's trying for us, it's trying for you, it's really trying for our educators. But the delivery of the vaccines this week really did provide a wonderful burst of energy for us around here. It gave us a chance to visualize what things could be like when we get through all of this. As a nonprofit, the stakeholder of Bryan is our community. And accordingly, we've always understood the power of really vibrant, lasting partnerships for our long-term success. Over the past year's pandemic, the value of those partnerships took on even greater importance. But long before COVID-19 began, we had been having conversations about partnerships with Bryan Health, Bryan College of Health Sciences, and Lincoln Public Schools. How can we better serve our community together? What impact could we have if we leveraged our skills and talents? What are our dreams and aspirations to address both some of the healthcare needs and the educational needs of our community? Today, we are pleased to announce a 10-year partnership with LPS to establish a medical science focused program at the new high school being built in the northwest area of Lincoln. Through this program, we believe future high school students are going to learn about critically important healthcare careers, acquire the skills to make them successful, and really give them inroads to post-secondary education at Bryan College of Health Sciences and other Nebraska colleges and universities. And perhaps maybe these students will then remain in Nebraska to take care of future generations around here. The 10-year length of time is significant from our perspective. It allows us to invest for the long term, tinker a little if we need to, and really assess how our participating students and workforce are doing as the result of this. The rest of our presenters this morning will review the program in detail. I'll just conclude by saying we are truly excited to be working with Dr. Joel's team, and I would now like to welcome Dr. Joel to the podium.
Thank you, Russ. Appreciate the introduction very much. And I'd like to first start off by saying thank you to the men and women at Bryan Health for their tireless efforts during this pandemic. We are incredibly fortunate to have healthcare facilities like Bryan in our community, and their leadership and their dedication and their commitment to patient care is truly inspirational as we continue to work our way through this pandemic. We're already aware, but the pandemic has reinforced just how critical healthcare is to our community. Even before we had heard of COVID-19, we knew the demand for skilled graduates in medical sciences was growing. At Lincoln Public Schools, we've been working to identify and develop focus programs at our high schools to help inspire students to discover their passion and connect them to career opportunities. We know this formula works, as our students have indicated to us, as well as our community business partners as well. And that's why we are so excited in this time where we need good news, and certainly this is good news, to announce this joint partnership with Bryan College of Health Sciences to launch a medical science program, focus program, set to open with the new high school in the fall of 2022 that's going to be located and is under construction as we speak in Northwest Lincoln. This new partnership with Bryan aligns with our goals of empowering students to find academic success through authentic learning opportunities, rigorous standards, and individualized learning. It will also complement our other focus program offerings throughout the school district. As I said, opening in the fall of 2022, not too long from now, with the new high school, students will be able to earn college credit to help overcome the financial barriers some of our students may face. The Foundation for Lincoln Public Schools will work to help make that possible through scholarship opportunities. I want to thank the Foundation for Lincoln Public Schools for their continued commitment to our student successes. And again, we are very, very grateful for the partnership with Bryan Health and the community support to provide our students with another choice on their education journey, a choice that will offer many, many, many career exploration opportunities as our students and our staff begin to learn more about those things, those kinds of careers that are available through this medical pathway partnership. Now I'd like to welcome the president of the Lincoln Board of Education, Mrs. Kathy Danek.
Thank you, Dr. Joel. I would like to echo what Dr. Joel said with the gratitude how grateful we are to the staff at Bryan Health. Their efforts have not gone unnoticed. In 2017, the Lincoln Board of Education, in partnership with our executive team and our entire district, created a strategic planning process and adopted the goal to explore more STEM opportunities for our students. During the high school task force work prior to the successful bond issue earlier this year, our community told us we needed to look at providing more hands-on learning to our students. These opportunities needed to expand focus programs. I believe this new focus program addresses what our community members who served on that task force asked of us. By embedding this program into one of our new high schools, we will be able to build high-tech labs to simulate what students would experience in a college setting. I want to thank Lincoln Public Schools staff and the Bryan College of Health Sciences for working together over the last year to make this project happen. Community partnerships are what make a school district stronger, and they build hope for each and every one of our students. Now I'd like to introduce and welcome James Blake, Lincoln Public Schools Director of Strategic Initiatives and Focus Programs. Thank you.
Thank you, Mrs. Danek. Thank you for the honor and privilege to be here speaking with you today. The past year has been a great joy working and co-creating this with Bryan faculty, and I'm sure the next year and a half will go very quickly as we lead to opening this program. So this program is designed to prepare learners at the new high school by linking medical fields with existing LPS courses through immersive hands-on opportunities and experiences and early college pathways that are only possible by partnering with Bryan College of Health Sciences. For a student who knows they want to enter the medical field, the program will be a perfect fit. For students who may not know if they want to enter or they don't want to enter the medical field, they'll still gain necessary critical thinking and problem-solving skills that will be important for any field in the future. Dr. Kelsey Anderson, Provost of Bryan College of Health Sciences, and myself are going to take a few minutes and walk through how this program would look through the eyes of a student at the new high school. I'm going to talk about the pre-pathway, or the non-pathway, for all freshmen and sophomores at the high school. And then Dr. Anderson will talk about the pathway for juniors and seniors. So for all students starting as a freshman, we will work closely with the Bryan College of Health Sciences faculty to develop new examples, experiences within existing LPS courses. For example, in a biology class, we may work with Bryan faculty to come up with an example such as antibiotic resistance, and we would include that in our biology class to teach the same concept all other students get, such as evolution. We're going to repeat this process with math classes. We're going to add health, public health classes, and look at other courses also. If you think back to your time in school, which may be a while for some of us, those things you remember are usually when you were active in learning something relevant. By including medical phenomena, we hope to engage more students. Although students with an interest in medical fields are encouraged to start at the school as a freshman, that's not a prerequisite for admission. We would still accept juniors who transfer in for the junior-senior pathway. And with that, I'm going to pass this to Dr. Kelsey Anderson, Provost at Bryan College of Health Sciences, to take us through that junior-senior pathway.
Thank you, Dr. Blake. We are so excited for Bryan College of Health Sciences to be embedded within this new high school, again at the Northwest Lincoln site, where we will not only be able to offer students our high-quality college courses, but we will also contribute to the development of the healthcare workforce of the future. Pre-healthcare is one of the largest areas of interest among high school students in Lincoln, and we anticipate about 300 junior and senior students to be enrolled in this pathway. Following the pre-pathway that Dr. Blake outlined, students will be able to dual enroll in up to 13 credits of college-level coursework. They will start in Introduction to Health Professions and then move on to Anatomy and Physiology, and then be able to receive CNA and phlebotomy training where they can start entry-level careers in the hospital. A number of online general education courses will also be available to students. The face-to-face courses like Anatomy and Physiology and Intro to Health Professions will be taught within the high school classrooms by jointly credentialed teachers by LPS and Bryan College of Health Sciences so that students can receive both high school and college credit at the same time. As part of this program, high school students will take classes, but they will also be grouped with Bryan College of Health Sciences mentors, taking advantage of the robust mentoring programs that we already have in place here. This is an opportunity for focused program students to learn and grow from college students who are already living the life of healthcare. In addition to mentoring, we plan to offer immersive opportunities and activities for dual enrolled students, which may include labs held on the Bryan College of Health Sciences campus, where they will be able to interact with our cadavers and other specimens we have here, as well as shadowing experiences within Bryan Medical Center. The ultimate goal of this program is to prepare students for more and help them determine what's next for them in terms of their college and career pathways. We certainly hope that's with us at Bryan College of Health Sciences, whether in our biomedical sciences, sonography, healthcare studies, or nursing majors. And we hope they follow that education by gaining employment within the Bryan Health family. Thank you so much.